You're now live.
Good evening and welcome to this meeting of the Health and Adult Social Care Overview and Scrutiny Committee. My name is Councillor Patrick Canavan. I'm going to be chairing the meeting this evening. So we're going to start by asking if the Democratic Services Officer would read out the housekeeping notice, please.
Thank you, Chair. Please note that this meeting of the Health and Adult Social Care Overview and Scrutiny Committee is being recorded by the Council for live broadcast and will be published on the Council website for a minute. The meeting may also be recorded or streamed for live or subsequent broadcast by members of the public, although ultimate discretion in this matter lies with the Chair. For those in the room, please note that if the fire alarm sounds, please exit the building by way of the nearest available fire exit route and make your way to the surface car park at the front of the annex. Finally, please ensure background noise is kept to a minimum and mobile phones and other devices are turned off or switched to silent. Thank you.
Okay, thank you very much. Let's take apologies for absence, please.
Apologies for absence have been received from Councillor Matthews and Councillor Farr.
And are there any substitute members?
Yes, Chair. Councillor Moore is substituting for Councillor Matthews this evening.
Okay, thank you very much and welcome, Councillor Moore. Thank you very much for coming. Any declarations of interest from anyone, please? Councillor Coburn.
Thank you. I have my standard declarations. My husband is currently a non-exec director for Dorset Integrated Care Board, and I am in receipt. I work for an autistic man who is in receipt of direct payments from this council.
Thank you very much. Are there any others? Councillor Dedman.
I don't know if it applies to this particular paper, but board member of Age Concern Christchurch UK and board member of Christchurch Housing Association.
Councillor Salmon.
Yeah, so usual one from me as well. I'm an employee of Dorset Healthcare and a member of Unison.
Thank you very much. I'm going to move on to the confirmation of the minutes, and unless anyone indicates otherwise, may I assume that the committee agrees to confirm the minutes of the meeting held on the 15th of January as an accurate record. Everybody content with that? Okay, thank you very much. And action sheet, again, unless anyone indicates otherwise, may I assume that everybody's happy that that note sheet is a correct outcome of the committee meeting? Okay, thank you very much. So we are going to move on to public issues, and I'm going to ask the Democratic Services Officer if there are any, although I know there are some.
Thank you, Chair. The first is a statement from People First Forum, and I'd like to invite Sean Hayward and Ruth Crook to come and address the committee, please.
Okay, please come forward and speak at the microphone. Thank you very much indeed for coming.
Good evening, everyone. My name's Sean. I'm one of the trustees of People First Forum.
My name is Ruth Crook. I'm a family carer and a trustee on People First Forum.
Right. We have signed up the Bill of Rights to say the right to say no, the right to have the right to hear.
Our members with learning disabilities have spoken up about your proposals. Number 1, keep 3 centres, and number 2, lose all 8. We did not know about proposal 2. People with profound and multiple learning disabilities use the centres. They are a very vulnerable group. We think everyone should have their say.
Right. Nothing about us but us.
Our members are upset, fearful and angry. They say you should not close the centres. People need centres that are accessible and give us enough space to move freely, that are safe, and they have staff with specialist skills who know us well.
It therefore should not shut them down. They should stay open. We all go to with our friends, respect us, listen, and give us centre. Thank you very much.
Thank you very much indeed, and thank you for coming to address us today. Do you want to do next?
Thank you. The next question is from Jan Ryland, who's asked if I could read it out on her behalf. She's unable to attend today, unfortunately. Prior to COVID, my daughter attended 3 different day services, including Christchurch Connect. 2 of the day services, both run by Livability, have since closed permanently, so now Christchurch Connect is her only service. Also, after reading that the proposal said that community halls could be used, I have briefly researched hire in public venues, and I have found that availability was very limited. My problem is picturing what a future without Christchurch Connect would look like. My question is, can anyone outline what my daughter's day would look like regarding transport, venues, safety, activities and staff? Is there a clear vision of an alternative?
Councillor Brown, I think you could answer that.
Thank you. Yes, thank you for the question. We recognise the value of day service buildings and are therefore proposing that following the consultation feedback, Christchurch Connect remains open. There is also recognition that the community-based day opportunities market requires development and investment to provide alternative options for people to access. We already have a small but thriving provision of community-based day opportunities, which include smaller organisations who run services by paid staff and for some provide their own transport to and from the service. These services access community resources such as church halls, libraries, community centres and council-owned buildings, and we intend to ensure that any capacity of remaining Tricuro day services allows rental of space for community groups. We acknowledge that for some people, a community-based option may not be an appropriate provision depending on their needs. Therefore, the day opportunity strategy promotes a mixed model of buildings-based services and the development of community-based day opportunities. It's intended that this will lead to a greater range and choice for people to access services that meet their needs and wishes.
Thank you, Councillor Brown. We'll move on to the next one.
Can I invite Mr. Neil Drury to present to the committee, please?
Brand. Okay, statement. Our adult son, Peter, has Down syndrome and autism. His care needs are challenging and complex, and his vulnerability demands high levels of professional and expert care. Apart from providing a safe and secure environment, the staff and management of the existing day centres understand Peter's needs and the importance of continuity and consistency of care. This professionalism allows us to enjoy some essential respite, safe in the knowledge that Peter is being well looked after and safeguarded. We recognise the severe financial pressures on BCP Council and appreciate that our professionally managed day centres cost more than other types of day opportunities. That said, they are tried and tested and fit for purpose, and it is important when comparing alternatives to compare like for like. I fear that the level of support and care presently provided by our day centres is unlikely to be present in many of the alternatives being considered. My first question, as my wife and I get older, we need the peace of mind and continuity the present day building-based provision affords. Many of the strategies proposed day opportunity providers have open door policies. This would be totally unsuitable for the safety of our son. Independent private sector providers use of community halls and such buildings, which from previous experience often lack reliable services, e.g. adequate heating, hot running water, cleanliness, etc., fill my wife and I with anxiety for the health, safety, comfort, and mental well-being of our son and other clients. Most of the current clients assessing the building-based day centres need continuity in their lives. Without continuity, their anxiety levels will cause distress for them and their carers. Has any consideration been given to the potential damage this will cause to these vulnerable individuals and carers already under extreme daily pressure 365 days of the year? Question 2.
Do you want to answer that one first, Councillor Brown?
Yes, thank you for your statement and your question. We recognise the value of day service buildings and are therefore proposing that, following consultation feedback, Christchurch Connect, where we understand your son Peter attends, should remain open. We acknowledge that for some people, a community-based option may not be an appropriate provision depending on their needs. Following the consultation and drop-in sessions that we arranged in January 2024, we have incorporated the concerns of carers and those who access Tricuro day services in the papers provided for the Health and Adult Social Care Review and Scrutiny Committee and for Cabinet on Wednesday. The potential closures of services have been subject to an equalities impact assessment, and as per the papers for these meetings, have identified the following risk factors. So for people with a disability, a risk of change for those with dementia, some mental health conditions, learning disability and or autism. This includes negatively impacting the health and well-being of a person, lack of continuity of care, loss of relationships with other people using the service and their staff team, and establishing new relationships in an alternative for service. There's the risk of being unable to meet a person's needs. Change and or increase in travel may be a barrier for those with complex disabilities and conditions. Change could disproportionately negatively impact those who are socially isolated and or have neurodiverse conditions such as autism. And for carers, there's the risk that being unable to meet a cared for person's needs may negatively impact on the ability of carers to fulfil their role, the risk of loss of relationships and support networks for carers, and the risk of increasing carer strain. The recommended proposal for the future of Tricuro day services is therefore that Connect services to remain open and incorporate Highcliffe, Wallisdown and Westbourne Plus services that are already based there. In addition, Pool Plus to be relocated to Parkstone Connect and Moordown Plus service to remain open. The Highcliffe, Wallisdown, Westbourne and Pool Plus original sites would be closed. We hope that this reassures you that we've listened to people's concerns and provided an option that continues to meet the needs of people who access Tricuro day services and their carers.
Thank you. Okay.
Do you want to ask your second question?
Well, I think I should, although a lot of the points have been covered there. This was kind of drafted a while ago.
It's up to you. Please.
Well, I think it's worth actually stating, but it just endorses that. Okay, during the previous hang on, I'll start again. What's the name of this? It's the overview and scrutiny, isn't it? Upper OS. Sorry. During the previous overview and scrutiny council meeting, Councillor Salmon asked Mr. Gillings to explain why there was such a difference between the cost of day opportunity provision by individual community workers, community groups and independently run private companies offering day opportunities and the existing Tricuro Connect day centres. This question was not answered during the meeting, and my suspicion being that the independent and private sector operates on profit motives and operates with the inexperienced and reduced staff levels, meaning corners will be cut along with staff pay and the quality of training, resulting in a service which is not fit for purpose. Can Mr. Gillings please answer Mr. Councillor Salmon's question on this satisfactorily? Sorry to put that on you.
I think Paul's to Councillor Brown to answer that.
Oh, right, okay.
I'm happy to answer that, but obviously the answer's been prepared in consultation with Mr. Gillings. So hopefully I can give you a full and factual response. Right, okay. I'm not struggling. Turn that mic off.
Oh, I'll turn it off.
Okay. Thank you. Yeah, and I recall the question at the last Overview and Scrutiny Committee meeting as well. So following the consultation work and attendance at the Health and Adult Social Care Overview and Scrutiny Committee on the 15th of January, we subsequently met with the Day Opportunities Co-Production Group on the 24th of January, which you kindly attended. Following feedback from this meeting, we met again as a group on the 9th of February, appreciating you didn't attend that meeting on the 9th of February, to confirm revisions to the strategy. As a result, we added into the finalised strategy the following note regarding the cost of building-based day services. Building-based day services are often more expensive due to a range of factors, including managing the needs of a more complex group of people, including personal care and a range of health issues, staffing costs related to this, maintenance and running costs of a building potentially owned by the company, and for Tricuro services, having previously employed council staff on different terms and conditions in regard to pay and pension schemes. We also added the following definition of community-based provision into the strategy, as there was a need to define these services. So this is as follows. Community-based day opportunities are defined as smaller organisations that may or may not use a building in the community to run their services from, but are not purpose-built day service buildings. These services tend to provide for a smaller number of people with less complex needs, but have paid members of staff and assurances associated with a buildings-based day service, such as insurance in place, training for staff, staff checks such as DBS, quality assurance measures, policies, etc. We as a council have successfully commissioned these services for many years from existing providers who are primarily charitable or not-for-profit organisations. Our experience has been that the safety and outcomes for those accessing these services has been positive and the cost implications have been competitive. The Day Opportunity Strategy therefore proposes a mixed model of buildings-based services and the development of a community-based day opportunities to meet the needs and wishes of people who access services and their carers now and in the future.
Thank you. Okay, thank you, Mr. Drury. Thank you very much for coming. And I think we have one more statement.
Yes, if I'd like to invite Mr. Hardcastle up to present, please.
Good evening. My name is John Hardcastle, and my wife and I are carers of a young man who goes to Christchurch Connect. Closure of the day centre will impose an enormous burden on parents and guardians of the users. Many are elderly, certainly advancing in age, and we're unable to cope, resulting in many of the users having to be housed by the local authority at great cost to the public. Using parks and outdoor spaces, cafes, local halls will not be suitable for many of the users. Those on the autistic spectrum need their routine. Many users, our son particularly, has an obsession with food. Therefore, cafes are out of the question. Using parks will be weather dependent, and local halls, as we've already heard, are already heavily booked. Staff will have difficulty in coping with medical behavioural situations in the wider community. Those on the autistic spectrum need somewhere quiet and calm, a sensory room possibly if and when they have meltdowns. Some users, and again our son is typical of this, tend to wander off. Will the staff be able to cope with and keep them safe if they do? Many users need to feel safe. I'm not sure if they will, if they are having to meet in various different locations around the community.
Thank you very much for your statement. Thank you very much for coming. I'm going to move on, if I may, then to item 6, which is the Day Opportunities Strategy. And I'm going to ask Kevin Gillings if you would introduce this item, please.
Thank you, Chair. I just have a presentation to share, which I'm going to try and pull up now. So thank you for inviting me this evening. My name is Kevin Gillings. I'm the Commissioning Manager for Disabilities, which also includes day opportunities. Day opportunities, just to be clear, can mean different things to different people. They're about learning new skills, taking part in a wide range of hobbies and interests, accessing the community. They're also about supported employment, which is about supporting people with disabilities to be able to engage and consider paid employment or long-term voluntary opportunities. And very importantly for people who attend, it's about developing friendships and support networks. The term day opportunities will be used in this presentation when referring to all potential activities as defined above, as opposed to the terms day services, day centres or day care, which tend to have an association with the provision of building-based services. To give an idea of day opportunities, which encompass building-based services and also community-based activities as well, and community-based service, we have a short excerpt, which I'm just going to show. From people who use services, and hopefully they will explain much better what day opportunities are than I can. That playing. Nope. Try again.
My name is Tracy Alice Marcella. I'm making flower castle.
So this is a sunflower, isn't it?
Sunflower castle.
If you want to go. You're not working up.
Okay.
Go for it. Go.
I love pottery so much. I do my artist work.
One of my favourite activities at crisis times is my favourite thing is going swimming.
Just before you continue, Mr. Giddings, just need to apologise to members of the public as that video wasn't transmitted through the live stream. So they've been watching that, I'm afraid. But so apologies for that, but please continue.
Okay. Yeah, my deep apologies for that. Sorry, members of the public. Hopefully you can see this again. It's back on the screens, I hope. And we will send the link as well, if we can, afterwards as well, for anyone who wishes to access that. So we've been working on a day opportunity strategy for the last 2 years, very much in co-production. Co-production is when we work with people to achieve things together. And co-production group has consisted of really about 200 individuals and organizations within that. And we have very much worked with people who use services, people who rely on services such as carers, those people who provide services, advocacy groups, also NHS Dorset and other local authorities and councillors have been involved in co-producing our day opportunity strategy. It's very much about being strength-based, about looking at what people can do rather than what they can't, and asset-based in terms of looking at all of the facilities we have in our area and maximising the use of those. It's about innovation as well, and maybe looking at for doing things differently, and market shaping in order to commission potentially services, new services, and different services, and potentially decommission services as well. And of course, that has to be sustainable and within a budget that is under pressure. Following all of the project work, there have been 6 overarching design priorities and 25 proposals within those priorities, and these were agreed through co-production. These are a day opportunities review, and this supports a mixed model of day opportunities within the available budget. When we talk about mixed model, we mention about day service buildings as well as community-based day opportunities. Supported employment review is also important in terms of enhancing the offer of paid and voluntary work for people with a disability to access potentially paid work or long-term voluntary work. And we wish to work in partnership with our communities teams and their volunteer strategy. We also wish to develop day opportunity standards and support and develop a charter of standards for day opportunities. We wish to have a forum for day opportunity providers, which doesn't currently exist, in order to bring day opportunity providers together, to work closely together and to learn from each other. And we want to put in place quality assurance processes to make sure that the day opportunities we provide are of a good standard. We also wish to have data that we can gauge about that standard, about that quality, and inform our strategy. Transport has also been seen as an important area to review, and we wish to review those opportunities to enhance the travel offer, and this could include travel training, voluntary schemes to assist people to and from day opportunities, and more local services for local people, negating the issues of long distances to travel. We also wish to look at the cost and eligibility of day opportunities. We want to implement a framework for day opportunities charging because charges are quite varied. We wish to have a review of the needs assessment for access to day opportunities so that people can access more, and facilitating access to personal budgets so people have more choice and control over the services that they access. Accessible information is also important, and we wish to work with our information advice team to ensure that people have up-to-date information on day opportunities and simply know what's out there, but this should be available in a variety of formats and not just online. The government groups of the project, including the co-production group, have agreed that the day opportunities review, supported employment review, and standards and support for day opportunities should be taken through as the first areas for action. In December of last year, the draft day opportunity strategy was released for public consultation. There was a good response of 665 responses to the questionnaires, in addition to 50 separate representations, either via email, letter, or phone call. And we have 5 well-attended public drop-in sessions in January of this year. This provided feedback on how respondents viewed the priorities and led to clarification of some areas of the strategy, which we've mentioned earlier. For example, definitions of key terms such as community-based services and supported employment. In looking at the consultation report feedback on the strategy priorities, day opportunities review came out highest at 81%, followed by day opportunities standards at 76%. The cost and eligibility of day opportunities, transport and accessible information were around the 60% mark, with the lowest being supported employment review at 48%. The lower percentage attached to supported employment review priority was, we feel, generally impacted by it being less relevant to non-working age people, and the respondent profile for the consultation, with over half of the respondents being 55 years or older. There has been a strategic decision by the governance groups, including the co-production group, to include supported employment priority as one of the 3 priorities to be taken forward for review. This is due to the more urgent need to review the existing provision and make sure that it's fit for purpose and it actually assists people into employment. It is also in regards to the lower rate of people with a learning disability in paid employment in our area compared to regional and national figures. In addition, it is an important and possibly the most important area attached to young people of having the opportunity for paid employment and therefore increasing their independence and reducing reliance in the long term on services. In addition to the strategy, two proposals that were not co-produced were put out to public consultation. These were in regards to Tricuro day services. Tricuro currently operate 8 day services. 5 of them are plus services for people with a specific needs, such as older people with dementia, people with a mental health issue, or people with complex learning disabilities. And then there are 3 larger Connect centres, which are open to all people with either an assessed need or disability or need for some support. Consultation proposal 1 was to close the 5 plus centres and move people to either community-based services or larger Connect centres. 3 of the plus centres, namely Highcliffe, Wallisdown and Westbourne Plus, have not reopened following the pandemic lockdown in 2020, with people currently accessing services at nearby Connect centres. Consultation proposal 2 was to close all 8 Tricuro centres and move all people to either community-based services or to day centres operated by other providers. From the consultation feedback, the disagreement in the green bars on this figure were for those services that have been relocated for their original bases to close, were for Highcliffe, Wallisdown and Westbourne, were around 55% disagreement. But there was 45% agreement or accepting the proposal, but with some concerns. For Pool Plus, the disagreement figures were 65%, and for Moordown Plus, it was 71%. When we look at the disagreement figures for the Connect centres of Boscombe, Christchurch and Parkstone Connect, this was more stark, with 93 to 94% disagreement with these services closing. Taking all of that into consideration, the consultation report findings, previous engagement that we've had with stakeholders, and that has been people who use services, carers and the staff teams of Plus services, and the available budget, 5 options have been outlined for the future of Tricuro day services. Option 1 was to close all Plus services, which was consultation proposal 1. Option 2 was Moordown and Pool Plus and the Connect centres to remain open, with the 3 relocated services of Highcliffe, Wallisdown and Westbourne remaining at the Connect centres. Option 3 was for all services to remain open and return to their original bases. Option 4 was Moordown Plus and the Connect centres to remain open, with Pool Plus being relocated to Parkstone Connect and the 3 other Plus services remaining at their Connect centre bases. This is the recommended option. And option 5 was for all services to be closed, which was consultation proposal 2. All options have been considered with a benefit and risk analysis, and the impacts of closure being fully explored in equality impact assessments. Our recommended option 4 in full is as follows: Connect centres to remain open and incorporate Highcliffe, Wallisdown and Westbourne Plus services already based there. In addition, Pool Plus to be relocated to Parkstone Connect and Moordown Plus service to remain open. Highcliffe, Wallisdown, Westbourne and Pool Plus original sites would therefore be closed. The financial implications of this recommended option are as follows. The current budget for Tricuro day services for this financial year is just under £4.5 million. There would be a reduction in Tricuro day service costs as a result of the recommended option 4 to the tune of just over £2 million. but this would create reinvestment into the day opportunities services of 574,000 and a net saving to BCP Council of £1,284,400. The recommended option responds to the consultation survey to keep Connect centres and More Down Plus open. It also responds to people at Pool Plus who made it very clear that a specialist provision was still very much needed in the pool area for older people who may have dementia. For Highcliffe, Wallisdown, Westbourne and Pool Plus, necessary adaptations to their relocated services at Connect centres could be considered. It also provides for a mixed model of day opportunities as recommended by the strategy in terms of having building-based and community-based day opportunities. It maximises the capacity of those expensive buildings to ensure that we are utilising them. And it also enables those services to develop as services because they've required a decision. We would be very keen for those services that remain as well to become community hubs, and therefore any capacity they do have could be opened up to community groups, community day opportunities to be able to operate their services from there as well. So thank you for listening, and I'll invite for any questions.
Thank you very much indeed for that. So we'll take questions next. Are there any questions that any members want to ask? Councillor Moore.
Thank you, Chair. Well, as you know, I'm only subbing on this committee, so, forgive me for asking some probably daft questions. And I have to say that I had to read this report several times to make proper sense of it all, because I'm not familiar with the terminology or the needs of current users, because it's all very different from the last time that I was involved. For example, I had no idea about the difference between the Plus, the Connect and the other services. And I had to read the report several times before I was able to work it all out. And can I also thank whoever forwarded the list of providers this afternoon, offering all the interesting and varied activities, because I had absolutely no idea all this was happening. So thank you for that. I'm learning a lot here tonight. Thank you. Well, looking at the recommendations, I didn't know before, but I do now, that 3 centres, Highcliffe, Wallisdown and Westbourne Plus, closed during COVID and haven't been used since. So can I ask if the former users are now happy with their new arrangements? I've got another question as well. Looking at Pool Plus being relocated to Parks and Connect, I agree it's not far away, but can the appropriate improvements be made at Parks and Connect to meet the differing needs of everyone coming from Pool Plus, and at the same time keep everyone in their same friendship groups? Because I believe that's the most important thing. Thank you.
Are you able to respond to those?
Thank you, Chair. Thank you for your questions. In regards to the 3 relocated Plus services of Highcliffe, Wallisdown and Westbourne, we went out to groups in June of last year and spoke to them extensively about how that journey had been for them. There was certainly for Highcliffe and Westbourne Plus, which is currently Highcliffe at Christchurch Connect and Westbourne Plus at Boston Connect. They were really happy with the provision actually, and I think for Highcliffe as well, they had the separation from Christchurch Connect. What they felt was, though, there was some refurbishment work as well that was required, and we have had since building surveyors out to quote for that work as well, and pending any decisions made in regards to these services, and we would look to progress. Westbourne was similar, that they were very happy. Actually, these are people with mental health issues. They actually like the hubbub of a busier centre and being able to make more friendships as well. But they also requested some adaptations. Name one particular one was an art room for themselves rather than a shared one, because there's quite a few budding artists within that group as well. For Wallisdown Plus, that is based at Parkstone Connect for people with complex learning disabilities. It was more of a mixed view, actually. There were some people who really had integrated into the centre, and there were others who felt that was harder for them to achieve as well. So we spoke with staff there as well, and we said about making a separated provision, which they currently have. But actually, what was particularly needed was a more quieter space, particularly when having meals, for example, or just needing some time away from a busier area. So again, we've had building surveyors out, and it's not, fantastically expensive to be able to create that off of one of the main rooms that they currently occupy as well. So to answer that first question, we have engaged with people, and the general trajectory was that it worked reasonably well. Not for all, but for the vast majority. Yeah. For Pool Plus services, we've also engaged with people who use those services. Very much as per my presentation, they required that continued provision as well. And interestingly, we've been over to Parkstone Connect again with surveyors to look at a possibility of moving, just to check that option out. There was originally a centre called Four Ways, which was which was relocated as well at Parkstone Connect. And very interestingly, over time, actually, those people who access Four Ways have wanted to become part of the whole centre as opposed to a separation. But what it does lend itself to is that there is an area that was designated for Four Ways to have that separation, and that could be converted to Pool Plus, which might be more relevant for people, particularly who have a dementia diagnosis, who do require more kind of secure environments.
Thank you. Okay. Councillor Salmon.
Hi, thanks, Chair. Also, I didn't turn up early enough to have a chance to say, but sorry I'm not there in person today. Been a bit unwell myself today and had a bit of a health scare, but I'm feeling better now for some rest. And I also wanted to say thanks to all the members of the public who turned up. I can't actually see if they're still in the room now, but I thought they all spoke very elegantly and whatnot. And I'm sorry to a gentleman if he's still there that I didn't get a follow-up to my question from last month and noticed it hadn't been answered, but I'll try not to mess up like that again. I'm just turning to the presentation. I was interested at the lumping together the accept, but with some concerns, and the agree with the proposal. I wouldn't lump those two groups together, and I would be worried almost about how that data was gathered, because that doesn't seem like a particularly good option to have even had on there. I mean, if your house burns down, you accept it, doesn't mean you're glad it's happened or think it should happen. Oh, that was just a little frustration I had with the way the questionnaire had been drawn up. I think you have a lot of power when you draw up a questionnaire, but I'll leave it at that.
Thank you. Do you want to pick up that point?
Yeah, thank you, Councillor Salmon, as well. I do accept the point that when the proposals went out, it felt like a very binary choice, and I think we discussed this in the January overview Scrutiny Committee, and we have since made it very clear to people who have been involved as well that it was less of a binary choice between proposal 1, proposal 2, and indeed where we've come to with the recommended option is less than proposal 1, as you would say, in terms of More Down Plus would remain open, and we are only considering Pool Plus and those relocated services to close. But I do accept that point, and I think that could have been handled better in terms of making that clear to people, because I think it did set a few hairs running as well with that very binary choice.
Just as a point of learning, I've got to just follow up on that. I'd really love to understand why it wasn't simply agree, whatever it is, the standard, strongly agree, slightly agree, no opinion, slightly disagree, strongly disagree. I'd love to understand where that decision was made, at what point when that questionnaire was drawn up.
Any ideas why that was?
Yeah, I think we drew that up with the consultation team, so it was on their advice. I think for collecting data as well, sometimes having more start choices is easier to represent. But I take the point, and I will take that back to the consultation team as well.
Fantastic.
I
Thank
think
you.
I think we're all learning lessons about consultation process. I'm going to take Councillor Carr-Brown next, please.
Thank you, Chair. I too wanted to echo Councillor Salmon's comments to thank people for coming this evening and speaking very eloquently. It mirrors many of the comments that I heard when I attended one of the consultation events at Moordown, and that was extremely enlightening. And it's always good to hear from service users so that we fully understand what these services mean to people. So thank you very, very much. I'm relieved to see that Moordown Plus is being recommended to stay open. It would have been, frankly, madness to close it. So I'm grateful for the movement on that. My point that I just wanted to raise, and I'm always very keen to look at language, is on your penultimate slide. You talked about necessary adaptations can be considered. And we also, later on, we have about considering particularly Moordown Plus, it's mentioned, can be considered a hub for other services. It strikes me that particularly if you're moving Pool Plus into Parkstone, these adaptations will be considered. They surely will be done before services are moved. It's not, I don't like the language of can. It doesn't feel strong enough to me.
Mr. Hornsby.
Thanks, Councillor Carr-Brown. Yes, I think the way the presentation has been put together is to try to be not. Let's answer the question directly. Pool Plus people can go to Parks and Connect without any further adaptations. That there is a separate entrance, there's a separate area that's separate, completely separate from the main part of the day centre. So that doesn't need any work. Some additional improvements to further enhance it could be done. We'd need to apply for some capital monies for that. So Cabinet making a decision on the recommended option will then lead us to putting forward a proposal for some capital to do some improvements. It doesn't, but we can meet the needs of people without any. I think necessary is the word that's the problem here, rather than may or will. So there aren't necessary changes to be made to accommodate people, but to further enhance the buildings, some capital would help with those further improvements.
Okay, thank you. Couple more. Councillor Edwards.
Thank you, Chair. I'm very pleased to hear that Moordown Plus will remain open, and I'm sure those residents that contacted me and other councillors about that are going to be very relieved with that as well. And I'd like to thank the members of the public that came. I just wanted to ask, Kevin, did I hear right when you said the 3 centres had already closed? Did you say they could be repurposed, or are they likely to be sold and then the money used for upgrading the day opportunity places that are staying?
Mr. Hornsby.
Thanks, Chair. The reason I've jumped in isn't because Kevin can't answer the question. It's just I sit on a wider corporate property group, and any buildings that are no longer required for the purpose they were originally being used for will be considered either for an alternative use within the council, and that could be for children's services, for example, or another department, but they could also be sold if that was the option that the council chose to take. And that money then would come as a capital receipt and can be deployed either on adults, children's, or any other service. So that's part of the capital bidding process to put forward your proposals. But I'm sure the Cabinet would receive this favourably if we said we wanted to reinvest some of that money into the existing services to keep them fit and well for the future.
Thank you. Councillor Denman.
Yes, thank you, Chairman. Thank you for the presentation. We had a sheet of other providers. I don't know if you've seen it. I expect you generated it.
Yes, Mr. Giddings was kind enough to send it to me.
Well, I noticed that there are quite a few people missed off. And one, I mean, Coda is on there. I'm very surprised to see that. I know Coda of old. They're not in any way Well, I just find it surprising that you've put that down as, oh, well, there's an alternative, because I don't believe that that would be seen as that. You've also got Highmore Farm and places like that. I really think that it's, I don't wish to be rude, but fudging the issue to say, look, we've got all these places. You didn't put down, for example, Greystones, which has loads and loads of opportunities. So I find that a bit difficult to go for. But my main question is on page 36, summary of public health implications, you say on that page 28. It is anticipated that there will be long-term benefits for the health and well-being of those who access services and their carers in the BCP area through implementation of the strategy. And again, I mean, I can't see how you come to that conclusion. You talk about, and I'm particularly interested, obviously, in Highcliffe and the further end of Christchurch, not the end that's near Bournemouth. I know a lot of people in Highcliffe have just stopped using all those facilities that were once offered at Highcliffe Day Centre, as we used to call it, whatever it's called nowadays. I just find it difficult to accept that we're doing this because we want to improve the services. I think we should come straight out and say, we are doing this for other reasons. Highcliffe Day Centre, for example, as the officers know very well, is one of my, not a hobby horse, but I'm very concerned about it. It's in a terrible state at the moment. It has been closed since before the pandemic, never reopened. It was very much well used. I know the local nursing homes used to go up there and assess people. And I just find it sad that we're trying to spin this as, oh, it's all going to be wonderful. And I think we should accept, and certainly Highcliffe residents have accepted, and Muddyford and Friarscliffe and all the people who do not live in Christchurch, we've had to accept that it won't be a better service, it will be a different service, and it will be adequate. So I'm sorry, I'm always really upset. I must declare an interest in that I used to own and run a nursing home, and I do know this pretty intimately about what people want. Thank you.
Thank you.
That wasn't particularly a question, Chairman. I'm sorry.
Any comments?
I would just say, thank you, Councillor. The list of organisations we gave you were the ones that we currently commission with. There are many others, as you mentioned, Greystones, for example, and there are many other groups that are out there that we don't commission with that people will pay to attend, get a lot of support from as well. I would also add that, we've not done this in isolation. This has been a project that's been running for 2 years. We have worked with lots of other local authorities who have been on a very similar journey, and we have also learned from their journey as well, in a very similar sense of what they've done and the outcomes that people have had as a result of potentially accessing alternative services that they may not have had the ability to, or they just simply weren't there to access prior to a strategy that rolled out an additional community provision. So I would say that, potentially I guess it's maybe wait and see in this area, but I think having more community-based groups potentially could be a positive for some people, but not for all. And that is why we've always said that the strategy is a mixed model of having those day opportunity buildings, which are day service buildings, which are very important, as well as an enhanced number of community-based groups as well.
Thank you. I know Councillor Summers raised his hand. I just wanted to follow up on that, if I may abuse my position as chair for a second. Thank you for sending that list, which was the list of the commissioned services which the council commissioned. So one of the aspects in the strategy talks about this possibility of what's described as micro providers. So I wanted to get a better understanding of how those are going to be commissioned. Are they going to be commissioned? Is there then going to be the same possible distinction between commissioned micro providers and non-commissioned micro providers? Does that make any sense?
I'm probably best to answer that, Chair. I'm the Head of Strategic Commissioning for Disabilities. My name's Siobhan Han. So we have a project going on at the moment where we are going to be working with the Community Catalyst. That's an organisation that go out and source micro providers on our behalf. So the piece of work that we will be doing will be looking at how we can work with our communities to identify what sort of services they would like. So they could be personal assistance, they could be supporting people with their gardening, going out to different activities. There's lots and lots of different activities that people might want to do. And then what we do is we advertise for these micro providers, which are very small providers that will come in and provide those services. So we don't directly commission them ourselves. What we tend to do is create direct payments or individual service funds where people can actually purchase them themselves. So it's individuals commissioning them for themselves rather than us commissioning them for them.
Thank you. Councillor Salmon.
Oh, sorry, I've just had a moment's peace and then the room has filled up with my family. Give me a sec. So sorry. So it's probably more of a question for David rather than any of the officers. So the strategy doesn't seem to currently include any consideration of better using some of those buildings that are due to close by bringing in other groups. And I know that's something as soon as Moordown was considered for closure, myself and Kate have been trying to talk to yourself about, and I'm not going to be too direct or critical because it has come back to me via my group leader that I can be too direct and critical of people in the past, but it is frustrating that that still doesn't seem to be happening, the examination of that option, and that I think I've just double checked in with my wife. We're still waiting for you to respond to some emails that we've sent to you on the topic. And it would just be nice if this strategy maybe had a slightly wider scope of just going, do we close or do we keep these open? But did look at some hybrid ways of working that would keep some of these centres viable. I hope it's not too late for us to start looking down that path.
Mr. Brown, can you help with that?
Yeah, I can help with that actually. And I know, yeah, we've had I know we had some conversation last week about the Moordown. I think the Gateway Club, wasn't it? We sort of talked about last week. I think the process really is to get this strategy approved, and I know it's talked about a lot of the. I went to virtually all of the drop-in sessions, and I know it was talked about a lot of the drop-in sessions about where those day centres weren't operating at capacity, about sort of working with other, you know, them working more up towards the capacity or working with others for that. I think the process will be get this daycare, this day opportunity strategy approved and be clear about the future of the various day centres. And then there is definitely the option to talk to others where there is capacity at those Tricuro centres to sort of share those facilities really. And I couldn't I think it's very much comes down to those sort of individuals as to what's appropriate for them, whether it is a Tricuro day centre or an independent day centre, or all that whole list that you referenced, the list of the commissioned day opportunities. I'm familiar with quite a number of those commissioned day opportunities from my previous work in community centres. I've certainly met Be Creative, Good for You, Well for Life, people like that. And I know a young man who actually attends these day opportunities pretty much every day of the week. He was at Well for Life this morning. So I know the sort of, on a regular basis, the sorts of things that they deliver for individuals. And I think it's, some of those may work well working with the Tricuro centres, but some of them very much need their own space, their own base, their own sort of flexibility of operation. So I think it is a bit horses for courses, really. So
thank you. Yeah, yes, that issue actually of the Gateway Club was, I think, highlighted at the drop-in centre at Moordown, and I know it has been raised both with Councillor Brown and indeed with some of the officers who are looking at how we might, or if we could, utilise that space as effectively as we can without interfering with the service or, distressing anybody that uses it at the moment. So I think it's very much something which is still under consideration. Betty, did you want to add to that?
Yeah, I just wanted to slightly add just around when people come into adult care, when individuals need our support in whatever way that might be, that when they're having that conversation with their social worker or their occupational therapist or whoever the professional who's talking to your families, what they will do is have that conversation. And they've had that conversation with your families because your son is where he is and your daughter or your mother or whoever where they are. And it's really important that people who need to have a variety are able to have a variety, because if we don't do that, then it almost becomes quite restrictive. So people may have a very mixed bag, and it's important that they're able to have that. And I think the conversations tonight are trying to really illustrate that, if a building base is what works and what's needed, then, it's important that those considerations are given for that. But equally, if there's something else, that when Suzanne talks about micro providers or people having a direct payment who want to have a direct payment, they're all looked at in the same way, but you might go down one pathway or another. It's really important that we're able to offer that so that people have that control and are empowered to make those choices and to have access to those provisions that might stretch them in the way that they want stretched. And I think that's what's really important when people first come into contact with adult care or when they're having their review, that they're able to talk about what they might like and what might suit them, and that carers like yourselves and representations, advocacy groups such as you are able to really put that view forward as well. So I just wanted to kind of just illustrate that. Really, that is, that's what's happened. That's what happens, and that's what should happen, because it's the right thing for the collective group of people that come into adult care. Thank you, Chair.
Thank you very much indeed. If everybody's content, I'd like to move on to the recommendations that are in the paper. So there are two. A is that we review the adult day opportunity strategy, which Kevin kindly presented earlier, and we've seen the document in the paperwork, but also that we look at the recommendation on the Tricura Day services, and we've seen the recommendation that Councillor Brown mentioned, which is the option 4 in the paperwork, and the recommended option that is now being put to us. I'm just wanting to ask if everybody is content with that, because I'm due to go to Cabinet on Wednesday to give the views of this committee to Cabinet about the paper. So if there is anything other than that you wish me to say, I think now's the time to say so. Thank you. Councillor Dedden.
So, Chairman, the recommended option for the Tricura Day services, Connect is to remain open and incorporate Highcliffe, Wallisdown and Westbourne. Is that the one we're looking at?
Yeah.
And all the ones to be moved? Well, I don't want to associate myself with that because I don't want to see Highcliffe totally lost to our asset divest. So no, but I mean, no, I would prefer to not be involved in that.
Okay. Any other comments about that recommendation then? Because I will bear that in mind, Councillor Dedman, and feed that back to Cabinet when Cabinet meets on Wednesday. Anything else anybody wants to add? Oh, sorry, Councillor Salmon, I didn't see your hand.
I only stuck it up after Leslie finished speaking, as I think she convinced me. I think given last month when Councillor Rampton already she highlighted lots of issues with consultation. I'm not particularly impressed with some of it, and I'm sure everybody's worked very, very hard on it and all of that. But I do wonder if maybe the evidence base for the strategy just isn't there yet, and it's not a fully fleshed out thing, in my opinion, and it needs more work. Is that maybe an alternate recommendation that we make? Just because I know when we had we'll talk about it at the data working group update, but we don't have things like, oh, okay, how many miles travel time is this adding to service users? We don't have that. Oh, I can't remember the software you'd use, but the GIS data or whatever it is, where you'd be able to plot, this is where all the service users live, you know, this is where we would send them to, this is how much journey time would increase on average or decrease or whatever. That just doesn't exist yet for this to be a data-driven decision, which I think it should be, because it should be about improving things. It shouldn't just be a cost-saving measure. You know, we should be able to make things better when we change them.
Okay, thank you. I mean, again, if everybody's happy, I'm quite happy. You know, I'm quite content to feed that back into Calumet. Sorry, Councillor Brown, were you indicating you want to speak?
Yeah. Actually, I will just make one comment. I think it's important to remember this is partly it's about the day opportunity strategy, and it's for Cabinet to consider the day opportunity strategy, which has been developed over a good 18 months or so period, with a lot of co-production and a lot of sort of discussion, and the consultation. The recent consultation has sort of fine-tuned that and honed it and added bits to the strategy and tweaked it. And that's the one thing about the day opportunity strategy and the sort of way forward for the next 5 years in terms of day opportunities. And to remember that's sort of separate. It's linked, but I don't want them to be conflated really, that we say, oh, well, I don't think that consultations are great, you know, I think we need to review the strategy and redo stuff, because that's been a long time, the sort of gestation period for that. And the recommendation around the future of the Tricuro day centres is sort of additional to that, but distinct to an extent. So I wouldn't like the sort of the consultation views on what happens with the day centres to muddy the water about the day opportunity strategy which has been developed.
Yeah, point taken. So as I say, if everybody's content, what I'm happy to do is to feed those views back to Cabinet meeting on Wednesday. Is everybody, you happy with that?
Yeah, can I just clarify over the recommendation? So it seems that everyone was in favour of it, aside from Councillor Dedman and Councillor Salmon. Are you abstaining or are you voting against the recommendation? Just to be clear, please.
Well,
I hadn't actually put it to the vote, but
no. Oh, sorry, Chairman. We haven't had a vote on it.
No,
so
I'm
yeah.
Let's do that then.
Can I just come in? So sorry, Chairman, to butt in, but surely we need to actually put our comments, and that's what I thought we were doing. The Chairman said he will pass on my view about Highcliffe Day Centre, which everybody knows anyway, but I'll do it once again. And I mean, there are lots of things to make a comment on. So if we just have a vote and the vote will be carried because everybody but me and Joe apparently are happy with it, then that's not the same as putting what I said. I'm quite happy to go to Cabinet and put it myself, but I think it comes better from the Scrutiny Committee, because I did hear one Scrutiny chairman, it wasn't you, Chairman, say hardly worth having a Scrutiny Committee because they don't actually say anything. Well, we do, but you know, it's we should put it succinctly but firmly.
So what I was planning to do was to say to the Cabinet that this committee is supportive of the option that is before Cabinet, recommended option tonight, and that is before Cabinet on Wednesday. But you know that there have been other comments which I feel Cabinet should be made aware of. So that's what I was intending to do. Now, if that's not, if people are uncomfortable with that, then fine. You can tell me, but that's what I was planning to do.
I'm so sorry, I'm not staring at you, but Yes, I am happy as long as those comments get to Cabinet, not just 2 people voted against. It's that really that I'm concerned with. The committee itself is saying, yes, it's happy. But for example, I'm not at all happy about the micro providers. So, I mean, all those things should be aired at Cabinet, if you will. I'd appreciate it.
I'm going to say, trust me, Leslie, but that would be a bit.
Can I just say, Chairman, I do implicitly to put our point of view, but we need it put.
Thank you very much. Is everybody happy with that? I'm most grateful. Okay, well, that's the end of this item, and I'm not forcing the members of the public to go, but if you would like to take the opportunity, having completed that item, to go, then please feel free to do so. We'll just give you a moment. Oh, if you're going now, thank you very much indeed for everything that you've done. Thank you very much. Okay, colleagues, thank you very much for that. We're going to move on to item 7, which is the health and well-being strategy into action. I'm going to ask Gillian to introduce it, but just by way of introduction, there are 3 bits of paper supporting this document. One is on the joint strategic needs assessment. The other is the strategy into action paper, and the other is a kind of introductory paper on integrated neighbourhood teams. I think that's right. I've probably got that right. Some of that went to the Health and Wellbeing Board, and I felt it was quite helpful. It would be quite helpful for it to come here. So sorry, Gillian. Thank you very much.
Thank you, Chairman, and you've described very clearly what the short paper sets out. The committee's expressed an interest on a number of occasions on taking a strategic and data-led approach to setting your forward at work programme, and we thought in that context that these 3 papers would be worth sharing and for you to have the opportunity to discuss them. The Joint Strategic Needs Assessment is refreshed annually by Public Health Dorset and brought to the Health and Wellbeing Board. It was brought last month and signed off and agreed for publication, and that Joint Strategic Needs Assessment will continue to inform the work of the Health and Wellbeing Board going forward. The second paper around strategy into action followed on from a development session that the Health and Wellbeing Board held at the end of last year, and reflected a view that came through very strongly from that session about a desire to take a different approach to the health and wellbeing strategy, which is a requirement for every health and wellbeing board to set a strategy. But the direction that the board gave was we want not just to refresh our strategy, but actually to see our role, to see the Health and Wellbeing Board's role as to really drive delivery of that strategy by having an oversight role as the place-based partnership of the integrated care system is developed, and to focus on some key programmes and areas for delivery. In that paper, I would particularly draw out 2 paragraphs if you want to look into the detail of it. Paragraph 6 really looks at the strategic goals of the previous health and wellbeing strategy, maps them against the integrated care system strategy, and broadly the discussion at the Health and Wellbeing Board was the themes of that strategy continue to be the right ones, continue to be really relevant, but let's focus our attention as a board on the areas for delivery. And the paper includes some initial suggestions for programmes and transformation work at paragraph 8 that could be that area to focus on. Development of family hubs, proposed wellbeing hubs, integrated neighbourhood teams, supporting adults to live well and independently through the Better Care Fund, but also through the social care, adult social care prevention strategy and transformation work, community mental health transformation, going smoke-free, and looking at issues around cost of living and poverty and housing, all of which, if you look back to the Joint Strategic Needs Assessment, feature very clearly in the data. And then the third paper relates to one of those specific programmes, a briefing note provided by my colleague Kate Calvert, but very much a joint endeavour and joint piece of work within the integrated care system, and the programme that the Health and Wellbeing Board agreed was one that should be an area of focus. So that's the set of papers. Not proposing or expecting a detailed discussion of all of the content of that today, because there's a lot in there, but would really welcome any questions or any suggestions for areas that you'd like to spend more time on over the next 12 to 18 months as a committee.
Thank you very much. So yeah, this was a pretty high level kind of overview, really. Just trying to pick up things I'd had been through Health and Wellbeing Board and trying to ask you to look at whether or not there is anything in there that you might want to have a bit more of a deep dive into in terms of our committee. I have kind of put colleagues on notice about integrated neighbourhood teams that we might want to have a bit more detailed look at that at some point. I'm looking at the author of the paper and I'm hoping that she's not going to object too strongly to us being able to do that.
No, I think this is really important. And as Gillian said, this is very much a joint piece of work, and it ties in really nicely, I think, with both our integrated care partnership strategy, but also the strategy of BCP, Health and Wellbeing Board. So definitely think it's worth coming back and making sure that we are on track and can deliver as we intend to.
Thank you. Any Councillor Edwards?
Thank you, Chair. I fully support the idea of these community family hubs, but I do know that the residents in my ward are very concerned that although we do have a pharmacy that has a consulting room, etc., we do not have a doctor's surgery. And residents were moved to Alma Road and then that closed, and they've moved to Denmark Road, and they're finding it very, very difficult to get appointments. So I would hope that when we have these the family hub supporting all the health and well-being, and great idea, help them to stop smoking, etc. But a lot of people just want being able to go to see the doctor. So I do hope that the NHS will take up this and look at our the demography in the area and how easy or not easy to get to the doctor's surgery, because in some cases it can be 2 or 3 buses just to go to the doctor's, which is possibly only a mile and a half away, 2 miles, but it's very, very difficult for some people. And I don't know, this is sort of part of that, but I was hoping to have seen more about the Dorset Care Record, which seems to have taken forever to be rolled out. And it seems to be such a great initiative, having people's information in one place, with only certain people being able to access the bit that they need. But we've been talking about it for years and it doesn't seem to be getting anywhere. So I would certainly like to see a bit more push into that. Thank you.
Shall we take any other points and then come back to somebody to pick them up? Okay. Councillor Carl-Brown.
You saw the intake of breath. No, actually, I think my comment is quite sort of high level, I became concerned, I think, that we've got the Health and Wellbeing Board, we've got the Integrated Care Partnership, we've got the Integrated Neighbourhood Teams, and the group above that. And I just wondered, it seems to me we've got an awful lot of people doing quite similar things, perhaps, in a way. We've got the same people going to lots of similar-ish meetings, perhaps. I might be wrong. So please put me right if I am. Now, you could argue that that's fantastic. That means you've got lots of oversight across the piece, that everybody's having similar conversations. But I just got a little bit worried that we're getting quite top heavy in some of this. Well, top heavy may not be quite the right expression, but anyway, some reassurance about that, or an understanding of exactly who is doing what with whom.
Yeah, I'll find a different form of words, Councillor Cameron. But any other comments? Gillian, can you help with that?
I'll have a go at some of it, and Kate might want to come in on GP surgeries in particular. So to start with the point about governance, I think you're right to ask the question. The integrated care system is still a relatively new system that's been put into place. We've got the Integrated Care Board and partnership sitting at the apex of that system structure, if you like. But the role of health and wellbeing boards at a place level is extremely important, and one that we really want to build the focus on in the year or two ahead, because I think integrated care systems were always developed with the idea that place and neighbourhood should be the level at which integration really happens, and I think that's the place where we need to put most attention over the next while. There's certainly a risk in that context that it can just generate a lot of meetings for a lot of the same people with a slightly different label on it. I think that's a reasonable risk to draw out, and what I can assure the committee of is that none of us as officers, and certainly I think the same is true of councillors, have the time to go to excessive numbers of meetings. So that keeping the governance focused is something that we definitely pay quite a lot of attention to ourselves, and with our colleagues in the ICB too. We definitely don't want meetings for the sake of meetings. It's got to be about delivery, which is what the strategy is about too. On the Dorset Care Record, I mean, later on the agenda, I know that the chairman is going to give an update on the data working group, which is about the committee's interest in data more broadly. Obviously, the Dorset Care Record, I know, is part of what is helping us as a system to have the right data available. I don't know the details of where that project is and what might have where it's at and what the next phase of it is, but that's certainly something we could bring back to the committee at a future point if that's helpful.
That's Councillor Brown.
Yeah, I just wanted to quickly come in on that. Yes, I've taken on my role. The integrated care system is still sort of bedding in and finding its way, but I think it's important to remember that the sort of integrated care board, integrated care partnership, health and wellbeing board structure is a product of statute. Effectively, it's the way government have said we need to structure our health services and our sort of democratic input to that through health and wellbeing boards. And I think you're right. You could, unfortunately, it could be the same or broadly the same people attending different meetings in different places, having similar discussions, each coming up with their own strategies and action plans. But for me, I've sat on a couple of integrated care partnership meetings, and there's a real feeling in the room of people wanting to actually see change and wanting to actually move on from talking about governance structures and the strategy to actually delivering things and seeing action. And I think that's where the whole strategy into action bit has come from, and the push at the Health and Wellbeing Board is very much similar in our sort of development session that we didn't want a ICP have got a strategy, let's have a health and wellbeing board strategy, let's see where the, we wanted effectively the health and wellbeing board strategy to push ahead with actually making sure things are delivered. We can't as a health and wellbeing board say, right, we're doing this, we're doing that, but we can certainly sort of make sure that those that are responsible for delivering different areas do sort of report back, and we make sure things are happening. So I think you could be lost in the sort of governance strategy structure, but I think the people that I've met, certainly on the ICP and on the Health and Wellbeing Board, very much are wanting to see things delivered and things progressed. And I think that's where we're dependent on the people in those settings having that real push to make sure that actions are taken, and actually that we monitor those and we make sure they're delivering for people.
Thank you. I'll bring Katie in a minute, but I just want to echo that, really, having tuned into the Health and Wellbeing Board meeting. I mean, I don't think David Freeman could have been any clearer, really, about the need, to get away from lots and lots of strategy papers and to actually get stuff done. So I think that was really welcome. So, Kate, thank you.
Thank you. Thank you, Chair. And yes, I think the integrated neighbourhood teams work is relatively new. We're just setting up actually how we're going to implement it, because that's what we need now. We've had done a lot of work. We're at the point now we've just got to bring together to make sure that we've got the resources aligned to delivering of this initiative. It has been agreed across our partnership. So there's huge support and sign up for us. I think in terms of the governance in place, this is a program of work that would enable some of that development of what happens locally, and especially at a neighbourhood level. So when you talk about the general practice sustainability and where we've got practices and where we've got gaps, actually some of the challenges we've had with general practice is they can't recruit workforce. So some of them are really struggling. The ask on general practice in terms of delivering against their contract is quite significant. We've had changes where we ask general practice to come together to form sort of networks, which aren't a legal entity. It's just a group of general practices working together. There's challenges around that. We've got 18 networks, they're all quite different. I think what's important here is we've got an opportunity with our integrated neighbourhood teams to actually maximise the use of the resource we've got, and actually have that resource geared around meeting the needs of that local population. So when we looked at the JSNA, that's high level across BCP footprint, actually what we need to do is drill down once we've identified what's the neighbourhood footprint, which we're using wards as a baseline, as a starting point. Then we can actually do that more local strategic joint needs assessment of that neighbourhood, because then we can understand what does that need look like, particularly around the health profile, because actually the makeup of your teams then will look different. If we've got an older population in an area, like we know in Christchurch and Flagler, actually we could gear the resource that's going to best meet the need of that older population versus perhaps a more mixed or younger population in another ward. So that's what the plan is with the integrated neighbourhood teams. And this is it is an opportunity for us to help support general practice and their sustainability. They have been really struggling to recruit, particularly GPs. But not everybody needs to see a GP necessarily. Actually, it is about the right professional and having the opportunity to do that. We know we've got challenges not only in general practice, but they're starting to come up around community pharmacy. As well as, of course, we know dentistry. So we've got a lot of challenges that we need to actually bring together and address. We're very focused on delivery, and this is why we're at that stage where we need to pull it together. And I note the governance challenge.
Thank you. Two hands, Councillor Cameron.
So just very quickly come back on that. I just wanted to say to Councillor Brown, I'm not being rude, but I'm not lost in the governance structure at all. I'm very familiar with the NHS and how it's structured, and I understand the structure very well. I may be one of the few people who do. It's not easy. But and I'm health and wellbeing boards, all of these things, yes, they are statutory, but it's still what you do with them. Their existence is one thing. That's the statutory part. It's what you do with them. It's who you empower through them, and what you consider to be your priorities. That's what matters. And that's what I'm very keen to get a very clear sense of. And I really welcome what Kate's just said. It's very helpful. I'm quite excited, quite shamelessly excited about the idea of drilling down into the locality to that level, with the coordination and the high level above it, with things like the JSNA informing everything, and having some levers to really get into that. I think that could be very exciting. The problem I always have with these things is we've tried this before in so many different little guises, and it just worries me each time. But maybe this time, maybe, and there's always a bit of progress each time, absolutely. But anyway, thank you. I just wanted to reflect on that. Thank you.
Okay, 2 more hands, Councillor Dedman and Councillor Edwards.
Yes, thank you, Chairman. Yes, I think this is more or less the same set of people, or well, not people, organisations, when I was portfolio holder. I'm looking at Phil because I can't quite remember if it was all exactly the same or if it's even blossomed further. And everybody is working really hard, and I really think that you're doing a wonderful job. I'm not going to leave it there, however. No, I do, really. I think the whole idea is very, very good. I've never been happy, Chairman, with this top-down. I can't remember what they call it now, the opposite of escalating. Top-down to get to the locality. What we used to do was be little localities, and we used to do it all ourselves. And somehow it worked. But this is what we're doing now. I know we've got to do it. And I do think, and I'm sure David agrees, he sees the same faces at every meeting, but that's exactly why it works. I just wanted to say that I was looking at this paper, which is on page 107, which was from last year, I believe, unless the date's wrong. And it's the message from the board at that point that they'd like to see actual actions and what's been delivered in another paper rather than all this. To be honest, and this is just a purely personal view, I really don't like having all these papers from the presentations on this tiny screen. So I could do without those. I could do with just a succinct message from everybody at all the boards as to where we've got to. I noted, Chairman, for one thing, that apparently smoking has gone down in Boscombe, which is good. If you think that the council has anything to do with stopping people smoking, which I don't. But so I'm sorry, I'm not going to spoil it all by saying, being awkward. You're doing a wonderful job, and I do appreciate it. And thank you all.
Councillor Edwards.
Yes, thank you. It was just something that I'd picked up sort of reading through it. I thought it was very sad that our youngsters are higher than the national average for alcohol and drugs. And also we've got higher than average hip fractures, presumably in the elderly. And that can have a catastrophic sort of way of changing to life, in that when they come out of hospital, they may never go home. They have to go into a care home. So I'd really like to see sort of what work we're doing on that. But I have recently seen a video that's gone out from Hampshire on how to prevent falls. And it's actually really simple stuff on a lot of this, how to prevent falls, like sensible footwear, don't have trailing cables on the ground and things like that. But I thought something like that would be useful for us to use as well.
Okay, thank you. I'm going to ask if there's any wind-up comments, but just on that last point, I know when we've had presentations from our colleagues in public health, that trips and falls, is an issue which is very much on their agenda. Because of, as Councillor Edwards has said, because of the consequences and the need to keep people well. Sorry, I'm just looking to see if anybody wants to say anything finally before I move on. Councillor Brown.
I just wanted to pick up Councillor Dedman's comment actually about smoking cessation, which is, you know, in the paper there has been a sort of going smoke free by 2030 and a drop of smoking. I think I suppose it might not be anything to do traditionally with the council, but public health is very much a part of this council, and I would be shocked if they didn't have a hand in delivering that reduction in smoking, and certainly it's a core part of their being is about going smoke free by 2030, and I know they've just sort of ordered in lots of smoking cessation kits to help with that. So it is very much a part of what this council delivers in terms of its public health role. I suppose I'll just add also a meeting I was at recently when I think it was the Integrated Care Partnership, and it was talking about public health. None of these things are new or rocket science. It's not like we're trying to come up with strategies to find new ways of keeping people healthy or new innovative things. You know, a lot of it is the basics. It's about smoking. It's about healthy eating. It's about falls prevention. You know, that's been known about for a long time. It's about decent housing, good quality housing, and the people living in poverty. You know, it's all those sort of core things. It's the same things. Working on those areas works, and that's what we've got to keep working at.
Thank you. Can we move on?
Can I just come back on that? I just meant, through you, Chairman, that we are getting into what used to be called the nanny state territory, which I think we used to refer to Labour as. So, but no, I totally agree with you. I've said I think you're all doing a wonderful job, and yes, I agree. And also, like the councillor before me, yes, I'm very sad to hear that there's so much drug activity. We need to do more work on this. Absolutely agree. But speaking as a reformed smoker, I gave up without any help, and it's easy. So don't tell me that.
And on that point, I think we'll move on. Thank you very much indeed. I've never smoked, so never had to give up. So yeah, well, you know, had other vices, but that's a different story. So we're going to move on to the data working group. And give you a bit of an update if I can. So in the paperwork that was circulated, there are two documents really. One is the notes of the meeting on the 25th of January, which are just there for your information, but probably more importantly, there are copies of a set of slides, which are adult social care performance data, which we received at that meeting. And I think that they're quite useful for you to have, because within those slides, you can see quite a lot of links to other data that it might be useful. So just park that for a minute. We've had one more meeting since then. So that meeting that I just referred to was specifically focusing about adult social care. And the more recent meeting has been focusing on health. And we had a presentation from the colleague who is the expert on the DICE system, which I was just came away completely blown. My mind just blew about how much information that was held on that system. And what we've asked them to do is just to give, because we were actually viewing the live system and they were interrogating the system so we could see what was on it. What I've asked if they could do for us, just to do a series of slides, just so that it gives you an overview of what sort of data that information holds, and it's quite considerable. So we will do that. But the other thing is, once we have done that, the plan is to kind of bring those two sets of data together and come up with a kind of briefing paper for councillors and anybody else really who might want to see it, so that everybody has a kind of guide to where they might be able to access data on anything that people might want to have a look at. So it's simply to try and bring all of that into one place, so that if people were looking to try and find out where to start really on looking for data, they know where to go. So that's the next step, and what I'm hoping is that we'll be able to do that in time for our May, the next meeting of this committee in May, and our colleague Lindsay is busily working away on that. So that's the plan. But also, I think to try and use that document as a kind of reference point, so that if we're thinking ahead about our forward plan and issues that we might want to look at, we might want to have a look at what data there is on a particular issue, so you'll be able to see, well, is that data out there? Is it accessible? Or do we need to get somebody to do a bit more digging in terms of trying to get the information that we want? So that's the plan. So hopefully that I've got that right. So any issues or any questions on that? Is everybody content with that? Thank you. Right. You waved your hand and I didn't see you. Oh, that's always worrying. Thank you very much. I'm going to move on. So I once again put my hand up at being guilty of sending you lots of information for items for information, but there are three, I think, quite important papers there. I'm going to come back to Dorset Community Pharmacy in a minute, but there are papers there on the merger of Quarterjack Surgery and the old dispensary at Wimborne, and the closure of the Christchurch Medical Branch practices in Burton and Bransgore. So they're there for your information. But having said that, I don't want you to think that I'm going to prevent any kind of debate or discussion about it. But I do want you to obviously be aware of them. So if there are any immediate questions on those, please say so. On the Dorset Community Pharmacy, I kind of press down somebody into writing this, and I'm very grateful for them doing so. But I just read it and thought, wow, there is such a lot in there, and I think I just probably, unless there are any immediate questions on it that people might want, and I'm going to turn to people who might know the answers. Unless there are any immediate questions on them, then I think I'll let you have a bit of a read of that, because it is quite a dense document. So dense, is that the right word? Anyway, so that's my plan. Is there anything you wanted to add, Kate, on any of that?
Yeah, I think in terms of the community pharmacy, it's a lot of information there. And even when I saw the slides to share, I thought you're likely to have some questions. So more than happy to actually come back after a later date. We thought it might be quite good, though, for you to have a look and kind of get a sense of everything that goes on and how community pharmacy works. And if you've got any questions, then that could come through the chair, that we can then kind of gear a presentation around your questions, so that we can come back to the committee at a later date if you'd like us to do that.
Thank you. Is everybody happy that we do that? Thank you very much indeed. Pastor Dedden.
Are we able to comment on the closure of these?
Please, yes, please do.
I just wanted to comment as something I was surprised about, the closure of Burton Surgery and everybody in Burton coming to Christchurch Medical Centre, which is in Purewell, which is about 2 miles away. And on page 162, number 8, summary of environmental impact, no environmental change implications identified. Well, surely the 4-mile round trip from Burton is an environmental impact. So I'd really like, when you do these reports, I'd like them looked at in order to sort of say, well, actually, people are getting in their cars. I did notice, Chairman, that there's a mention of Burton being 1-point-something miles away on foot. But if you're feeling groggy, you don't always walk to the surgery. In fact, you can never get, well, no, I'm not going to go on about the surgeries because it's all on telephone and line. But still, no, I just thought that, when we think of the environment, we are going to lose Burton. I think it's a shame.
Anyone able to add any light on that?
I'll just, I take your point. Councillor, I accept that actually, yeah, any travel does have an environmental impact. But we go through quite a robust process when practices come to us and submit. They have to get approval to close any of their branches or their practices and consult. And it is really difficult because you're quite right. Yes, it might be a short distance, but we've got a community that might not necessarily be able to access in the same way. And we take that all into account, and we certainly consult with members of the community. So that it's still in process in terms of the changes, but it just wasn't financially. It was a workforce issue for the Christchurch Medical Practice. It's also because one of the partners recently passed away and had owned part of that building. So, of course, they had to sell the decision was taken to sell the premises. So, as much as we look for opportunities to think about it, it's a difficult situation that we're still working through.
Okay, thank you very much indeed. I'm going to move on. Portfolio holder update, Councillor Brown.
Yeah, thank you, Chair. I'll keep this shorter than last time. Last time we met 7 weeks ago, there was an awful lot to update on. It's been a very busy time, lots of different things going on. Just as a reminder from last time, there was a lot of work on budgets, but obviously the members, are aware that we've now set the budget and medium-term financial plan at the recent council meeting. There's a lot of talk about day opportunities and about the Health and Wellbeing Board. Those have come before committee tonight, so we've covered those already. All I'd say really is that there's been meetings and discussions. Cabinet are very much moving on now that the sort of budget and medium-term financial plan is there to look at the council vision and priority planning from that. So that's a sort of an important sort of shift in activity. And the only other thing really to report really that's coming up in a couple of weeks' time is to make you aware that Social Care Week is the week commencing 18th of March in just a couple of weeks' time, and that includes World Social Work Day on Tuesday the 19th of March. And if I just tell you, it's to provide an opportunity for social workers and others in the social service sector to celebrate their achievements, clarify what social workers do, as well as raise awareness and support for the important role of social workers play in the lives of children, families and communities facing adversity. So it's something you should be seeing communication and social media, etc., going on at that time. So something for you all to be aware of.
Thank you very much. Any questions for Councillor Brown? Thank you very much for that. Forward plan. So if I could just get you to have a quick look at the forward plan document, particularly in relation to the next meeting, which is on the 20th of May, so a wee while away. But the thinking was that we would try and cover the Home First Integrated Hospital Discharge Programme, which we kind of talked about doing a couple of times, but I'm hoping that would be okay. City, looking at Betty.
Yeah, that would be fine, Chair.
Thank you. And I have sort of asked about an update on Tricuro, and I think it would be fair to say that it might be easier to get them to do a kind of review of work to date rather than necessarily the future. Would that be okay?
Chair, as you're aware, there's a review going on of all the council-owned companies, of which Tricuro is one, and so there's a governance review, and then also a more fundamental review about what alternatives are there to the current delivery model, and how then that options appraisal is considered by Cabinet. So would it be helpful for a Tricuro update on the work that they're currently doing, the initiatives that they're trying to push forward, and how we're working over a development of a business plan, which is going to come to Cabinet in May? Would it be helpful to include in committee that business plan?
I think it would. I know Councillor Woods has asked a couple of times for for us to have just another bit of an update about Tricura. So if that's possible, I think that would be most welcome. Is that okay? And also to put on the agenda if people are happy to and people feel it's appropriate. Just again, a bit of a look at integrated neighbourhood teams, just to see where we are by the time we get to the 20th of May, and if there's any more detail that we can maybe put behind that. And then I think the only other thing that was in my mind to include was the point I touched on earlier, which is about the data, to try and bring that, whatever that document might look like, to bring that forward to that committee so you can see what data that we've put together and whether you think we need to do anything more with that, and whether it's what you want to see or what you expected to see as an outcome for the work that the working group's been doing. So does that sound okay for May? So is there anything else that anybody wants to raise or ask about in terms of the forward plan? Councillor Dedman.
Yes, I was interested in this, what we learnt today, or I learnt today anyway, about the micro providers and something called a community catalyst. And as I mentioned, CODA, for example. I'd really like to have some more information on that when it's available. I mean, not because it's going to obviously, you know, something to do with the day centre. No, I'm sorry, the day, whatever it is, opportunities, whatever's. Yes, it's going to be involved with that, and I'd really like to know what we're doing and how we're doing it. So that's micro providers, if you would, Chairman.
Okay. Well, maybe what's going through my mind is whether we can do the two things, but I'm not sure having thought about. But we'll certainly attempt to cover it in some way or other. Certainly making a note of it. Councillor Allen. That's a very good question. Has Louise gone? I think where we, Louise from Health Watch, I think where we were at the last time.
She's LB.
Louise, are you
Yeah.
still there? We're just asking
I am.
about dentistry, and I know you came to share with us the work that Health Watch had been doing on dentistry. I know you still are doing some work. Are you able just to update where you're at?
Yeah, I think there's a bit of work going on at the moment, so it might be good to bring an update to the May meeting, as you were talking about the forward plan, if that would suit everyone.
That would be fantastic if you feel able to do that. Just by way of an update on the work that you've been doing. Is that okay?
Sure.
Is that okay, Councillor Allen?
Yeah, happy to.
Thank you very much. I think that's probably more. That's probably more than enough. I'm getting the evil eye now that I put too much on the agenda, but we'll cope somehow. Okay. Anything else on the forward plan? Okay. Thank you. I might not be the chair anyway by now. I'm going to elect a new chair at the meetings. Thank you very much indeed. Okay, we've got the future meeting dates, which, as we just talked about, the next meeting is on the 20th of May. So unless there's anything else anybody desperately wants to raise, I'm going to close the meeting and thank everybody very much for your attendance. Thank you.
See you later all.